Hello, my name is Dr. Owais Rafiq and I am a pediatric anesthesiologist. Brave Khalid is a children's story that revolves around the journey of a young boy named Khalid. Now, Khalid unfortunately has to undergo surgery, and the primary focus of the book is to help children, parents, and hospitals understand and address the anxiety and fear that comes with children undergoing surgical procedures. Now, the aim of the book is to provide comfort and offer a supportive resource to children and families during a challenging and often stressful time. Well, I believe the target audience for Brave Khalid is kids aged between 5 to 12-year-olds, parents, and hospitals. Now, all hospitals where children are looked after should provide such a source to parents because 75% of children entering the hospital alone are anxious, and you can imagine if they need to undergo surgery, it just causes a huge fear. The book is designed in a way to help alleviate their fears and concerns. What's special about Brave Khalid is that it uses relatable storytelling and engaging illustrations all throughout the book to explain the surgical process in a child friendly manner. It helps children kind of understand what to expect during surgery and somehow provide reassurance, making the whole experience less daunting. I believe by addressing their anxiety, the book actually empowers children to feel more courageous and brave to face this huge challenge in their lives. The book is also designed keeping parents in mind as well. Parents of children undergoing surgery can benefit by having a resource that can assist them in preparing their child for the upcoming surgical experience, and also at the same time provide emotional support when it is needed the most in the life of their child. The book kind of equips parents with a resource to facilitate open and, I believe, age appropriate discussions with their children about surgery. It'll help them address their child's concerns, ease their anxiety, and ensure that they feel supported during this difficult and challenging time. Also, I feel the hospitals and the healthcare institutions can really benefit from using Brave Khalid as an educational resource to help reduce anxiety in their pediatric patients. I feel one of the ways that the hospitals can use this book is they should utilize this as a part of their hospital's pre-surgical preparation program, and it should be made available to all children undergoing surgery. It will help create a more comfortable and supportive environment for children, which will eventually lead to a smoother and less anxiety reducing surgical experience. Also, it can enhance that hospital's reputation for patient centered care and lead to positive surgical experience for the child and parents in the end. Uh, I was inspired to write Brave Khalid with a specific focus on children undergoing surgery because of my unique perspective as a pediatric anesthesiologist. And over the years, I have witnessed the anxiety and fear that children and their families often experience when they come for surgery. Now, I wanted to change the way children view the hospital and healthcare workers. They kind of tend to avoid interacting with us for a number of reasons, and I can assure you that anxiety and unfamiliarity are two things that top the list. So after going through a lot of research and scientific papers, I kind of recognized that the need for a resource that could help reduce this anxiety and help demystify the surgical process in a way that is relatable and accessible to children. So I approached the experts in the field of pediatric anesthesia, my colleagues and surgeons at the hospital, and we created Brave Khalid together with the goal to empower children with knowledge, understanding, and courage as they approach surgery. We wanted them to know what to expect, feel in control, and understand that they have a supportive medical team by their side. Plus, we also wanted to provide parents with a valuable resource to support their children through the challenging experience and somehow help them facilitate open communication with the child. Writing Brave Khalid honestly was a deeply rewarding and fulfilling experience, I must say. Throughout the whole writing process, I drew on my experiences working with young patients and their families, which greatly helped me empathize with their fears, concerns, and emotions, which helped me guide the tone and the content of the book. I wanted to provide children and their families with a reliable and trustworthy source of information about the surgical process and anesthesia. And lucky for me, drawing on my medical knowledge, I was able to explain complex medical concepts in a way that children could understand. The purpose of the book was to reduce anxiety for children undergoing surgery, and the driving force behind every word I wrote, knowing that this book had the potential to make a positive impact on the lives of young children and their families. And this is what kept me motivated and focused throughout the writing process. During the writing process of Brave Khalid, there is one particularly touching incident which kind of stands out. While working on the book, I had this opportunity to share the story and some early illustrations with a child who was scheduled for surgery. This interaction had a profound impact on both the child and their family. The child, who had been experiencing significant anxiety and was crying, agitated about the upcoming surgery, found great comfort when I read the story of Brave Khalid. The child could relate the characters, the fears, and felt reassured by the idea of having a caring medical team by their side. The child's anxiety I saw visibly lessened, and by the end of the story, instead of he being agitated and crying, was smiling. And also he began to ask questions about the surgical process, which was good because it helped me to have a constructive dialogue with the child. The incident immediately highlighted to me that the power of storytelling and the potential of Brave Khalid is genuinely going to help children undergoing surgery. It was a heartwarming reminder of positive impact that this book could have on children and their families, and it further reinforced my commitment to creating a resource that could ease the anxieties of children in similar situations. Well, one common theme that you will find throughout the book is bravery, and it is important to show bravery and courage in the face of any challenge, particularly for those children who are undergoing surgery. So, using Khalid as a brave young boy, this can inspire young readers to approach their own medical procedure with courage. Then you have supportive healthcare professionals. So, Brave Khalid highlights the role of healthcare professionals such as doctors, nurses, and especially anesthesiologists as caring and supportive figures who are there to help and comfort young patients. Then you have communication and openness. The book will encourage open communication between children and their parents, and this is very, very important to help build trust and bond between the parent and the children. And also it facilitates to have constructive open communication with healthcare providers as well. So all in all, the book helps in conveying the importance of discussing fears and concerns, which can help reduce anxiety and help build trust. We have also tried to demystify the surgical process by explaining complex medical concepts in a very simple and understandable manner. This will help the young readers understand what to expect during surgery. Also, the book is an excellent resource for preparation and knowledge. It will help empower children, provide them with information about the surgical journey, making them feel more in control and informed. Finally, I believe it conveys the idea that emotional support from parents and caregiver is crucial for any child that is going to face surgery in their life. So the book emphasizes the role of family in providing comfort and reassurance, which is very, very important for an overall positive outcome. Brave Khalid addresses the issue of anxiety in children undergoing surgery through several key strategies. First, the book employs a relatable narrative, with Khalid as the central character who experiences the same fears and uncertainties that many children may feel before surgery. Now, this relatability allows young readers to connect with Khalid and understand that they are not alone in their anxieties. Second, the book provides clear and straightforward explanations of the surgical process, anesthesia, and medical equipment, making this complex concepts of surgery understandable to children. Now, this really helps demystify the whole surgical process and eventually reduces the fear of unknown. The story also portrays healthcare professionals such as doctors, nurses as supportive and caring figures who are there to help and comfort children. This positive representation of medical teams can really help reduce fears and build trust. Fourth, I believe that Brave Khalid emphasizes the importance of open communication between children and their parents, as well as with healthcare providers. It encourages children to express their fears and concerns, which can help them support their emotions and provide reassurance from the loved ones. Fifth, I feel that the book actually empowers children by providing them with knowledge and understanding of the whole surgical journey. It will help them feel more in control and informed about what to expect during surgery, which can significantly reduce anxiety. Finally, I would like to say that Brave Khalid concludes with a beautiful message of hope, showing Khalid's recovery and return to normal activities. This message was key, as this message assures young readers that there's a brighter, healthier future beyond surgery, offering a positive outlook and experience throughout the surgical process. Yes, absolutely. Brave Khalid incorporates lots of features and illustrations that both children and parents will find appealing. You'll find colorful and vibrant illustrations that are designed to capture the attention of young readers. These illustrations bring the story to life and make it visually engaging for children. You'll also find characters in the book with expressive facial features that convey emotions effectively, and this will help the children to connect with the characters on an emotional level and understand their feelings. The layout of the book is designed to be child-friendly with easy readable text and a balance of text and images. The book is also designed to suit the age group of 5 to 12 years. The illustrations and features are tailored to the comprehension level and interests of children, which is in this part of the world mostly football, so it will help reduce anxiety for surgery. The book also includes imagery that provides reassurance and comfort. For example, illustration of caring healthcare professionals supportive family members, and overall positive outcome. All of these things together can help really reduce anxiety and build a sense of security for children undergoing surgery. Well, my knowledge of pediatric anesthesia and surgery definitely ensures that the book content is medically accurate. It also allows me to convey complex medical procedures and concepts in a manner that is both precise and accessible to children and their families. Now, having worked extensively with young patients, I've gained a deep understanding of their unique needs, behavior, and have learned to recognize anxiety. This helped me to address the specific concerns and fears that the children often experience when facing surgery, and which, as I mentioned before, is mainly related to unfamiliarity of the environment and unfamiliarity of the unknown. The book's content reflects this understanding, making it highly relatable to young readers. Also, daily interactions with pediatric patients and their families have cultivated a profound sense of empathy and compassion within me. These qualities you can find are reflected in the tone and the content of the book throughout, creating a supportive and understanding atmosphere that resonates with children and their parents. Most importantly, I emphasize the importance of open communication between parents and children, encouraging children to ask questions and express their fears. This will allow parents to provide reassurance and support. It's important that you help the children understand the surgical process using clear and age-appropriate explanation of the surgical process. Encourage children to trust their medical team. I also suggest the use of positive visualization techniques, encouraging children to imagine a safe and happy place, which can help alleviate anxiety and promote a sense of calm. I'd also recommend familiarizing children with common medical equipment that they may encounter. This will again help reduce anxiety by making these devices less intimidating and more familiar. Finally, I like to stress the idea that children can be active participants in their own care. Children can choose their favorite toy or comfort item to bring to the hospital, giving them a sense of control and comfort. In this book, I provide practical advice on preparing for the day of surgery, including fasting guidelines, gathering essential documents, and packing comfort items. Being well prepared can greatly reduce stress on the day of the procedure and help reduce anxiety. The book is designed to reduce the anxiety that children may experience when facing surgery. It helps empower them with the knowledge, demystify the surgical process, and convey a message of support and care from medical professionals. Now, this reduction in anxiety can lead to a more positive and less stressful surgical experience. The book also helps empower children by giving them a sense of control and understanding. They can actively participate in their care, make choices, and ask questions. This empowerment can boost their confidence and improve communication. Brave Khalid encourages open communication between children and their parents, and this provides a platform for discussion about fears and concerns. And this will help foster stronger family bonds and emotional support. The book offers age-appropriate medical education, helping children understand the surgical and anesthesia process. This knowledge can reduce the fear of the unknown and enable children to face surgery with greater confidence. Also, Brave Khalid ends on a positive note, showing Khalid's recovery and return to normal activities. This message instills hope in young readers, assuring them that there is a brighter and healthier future beyond surgery. The book also emphasizes the crucial role of family support. Parents and caregivers can use this book as a tool to comfort and reassure their children, and they can also find practical advice on preparing for surgery. The other lovely thing about the book is it portrays medical professionals as caring and supportive figures. Now, the book can help children and families trust their healthcare team. This trust can enhance the overall surgical experience. Brave Khalid also provides practical guidance on preparing for surgery, including fasting guidelines, packing comfort items, and gathering essential documents. This preparation can lead to a smoother and less stressful day of surgery. Yes, I collaborated with experts from Children's Health, Arlen Crumlin, Dr. Jacinta McKinley, a pediatric anesthesiologist, an expert in the field, and Dr. Buthena Picheri, a pediatric anesthesiologist at the Kingdom of Bahrain, also an expert in pediatric anesthesia, very experienced. Additionally, I also collaborated with a pediatric orthopedic surgeon, Dr. Sada Bashir, who is a master in her field as well. And then we had a brilliant illustrator called Haider Ali, who brought all the characters and story to life. Absolutely amazing artist and a wonderful person. Now, these collaborations were instrumental in ensuring the accuracy and effectiveness of Brave Khalid, and it made the whole experience of creating the book a memorable one. Drawing on the expertise of these professionals, the readers will definitely benefit from a comprehensive and well-informed approach to addressing the needs and anxieties of children facing surgery. I cannot thank them enough for their contribution. It has truly enriched the content and improved the quality of book, making it, I believe, a valuable resource for children and their families. In closing, I would like to emphasize the mission and purpose of Brave Khalid. This book was created with a deep commitment to helping children and their families navigate the challenging journey of surgery with confidence and reduced anxiety. My ultimate goal is to provide young readers with knowledge, reassurance, and a sense of empowerment. Facing surgery can be a daunting experience for children, and their families often share in that anxiety. Brave Khalid is a resource designed to ease these concerns by offering accurate medical information, practical advice, and emotional support. It is my hope that this book will serve as a comforting companion for children and parents during this journey. I also want to extend my gratitude to my colleagues and professionals who collaborated on this project. Their expertise and insights have been invaluable in creating a book that is medically accurate and truly supportive of its target audience. My message to children and their families is simple: you're not alone. Brave Khalid is here to guide you, to inform you, and to reassure you. With the right knowledge, support, and a positive outlook, we can face surgery with courage and optimism. I wish all young readers that their families are safe and successful journey through any medical procedure they encounter.